Hi, I'm Dr. O'Malley with Great Oral Health, Inc. And I wanted to share with you a few things that I've experienced in my last several decades as being a dentist, evolving from being a traditional dentist to being a holistic dentist and specializing in restoring teeth. So there's three reasons a person can lose their teeth over a lifetime, and one is cavities, the other is bacteria causing gum disease, and the other is if their bite is off or they rub or grind their teeth excessively. Those are the three main causes where you see anybody that's got crowns, bridges, all the way up to dentures, now they have implants. That's been the solution for them. And while we can put people on the moon, we're now sending people, we're getting ready to this big expedition to go to Mars, and all these advancements and technological improvements in our world, we still have as a solution basically fixing something that, in my estimation and many other preventative dentists' estimation, can be prevented. So the solution, probably 100 years from now, we'll look back at some of the solutions and go, wow, can you believe what all these people did to their teeth and everything? Man, it's so nice we don't have those problems. And that's the goal I have with Great Oral Health, is to bring about products that will help to diminish at least two of those three factors, which is cavities and gum disease, and bring that down to a more normal area where a person can be more proofed up, maybe even not have those troubles in an entire lifetime. Wouldn't that be great? That's the goal I have. So some of the problems that I've seen out there, you may find interesting. I've had patients that have come into me. I had one young man came into me when I was in Texas, 17-year-old boy, and he had just destroyed his teeth through sugar and a drug habit, unfortunately, and there was no recourse but to take out his teeth at 17. I mean, those are horrific things. I mean, it just tears your heart out when you see that, and you go, oh my gosh, he's going to have a lifetime of wearing a denture. And well, now though we have a solution, we can put dental implants in. But what if we caught that early? What if the bacteria in his mouth could be shifted and balanced and the pH improved? Let alone if he had a drug problem, you know, handle the drug problem, obviously, because that's its own problem in itself. But those are kind of terrible situations. And the solution that I saw at that time was to remove the teeth and put a denture in. But what if this person could have taken some of our products? What if we caught him earlier? And that's the whole goal of my company, is to get these products out en masse to people, to the families, and give them the tools that they can have to actually create a change in the balance of their bacteria in their mouth and do it naturally. I remember I had this other patient that came in, and not too long ago, and we know that there's a link in dentistry from heart disease to gum disease. There's studies from the American Heart Association, and we know that. And they find certain bacteria that we see in the mouth. They'll find on autopsy, they can see those types of similar bacteria lodged into those parts of the heart where there's been troubles. So, somehow it may cause an inflammation there, and the body comes in and maybe overreacts in trying to handle it. We don't know. I mean, that's still information forthcoming. But why wait for that information if we can control those bacteria? I mean, that would be the beautiful thing. And a patient in, and it was really sad. I mean, she was a bit overweight. She had gum problems. She had inflammation going on. She just didn't come back to the dentist, and it was too hard for her to get in. She didn't feel good. She had diabetes, and within 6 months, she had passed away. And I could tell by the health of her gums and her tissue, the real problem that she was having was going to be detrimental to her overall body. We can a lot of times in dentistry tell if a person has great inflammation in their gums, etc. Maybe they have a problem with diabetes. There's some imbalances there. There's a lot of telltale signs that we see that we can have an early hunch, and then we get the diagnosis checked out with a medical doctor. But the solutions are always after there's an event. And an ounce of prevention, right? Pound of cure. That's really the solution that we're going after. In Great Oral Health, how do we help improve the pH of the mouth? A very acidic mouth is harmful. It'll erode the teeth. A very alkaline mouth can be harmful as well. It needs to actually be right in the middle. And these are some of the products that may help with it. And that's my goal, is to help bring about this bacteria balance so that people now have a better solution where they can prevent these problems from happening in the first place. That's my goal, that's my passion, and that's my group's passion, what we want to do for you and also worldwide. Thank you very much.